And this webinar will also be recorded. And we'll be sending out a link to the recording after the webinar. So with that, I'm going to go over the agenda. We'll do introductions real quick, and then we'll go over the grant and schedule overview. We'll then go over the work plan and reporting, invoicing and advance payments. And at the end of the webinar, we will have an opportunity to go over any questions that you may have. And with that, I'll hand it off to Meredith Lee.
Hello, good afternoon, everyone here. Just as a friendly reminder, if you could mute yourself if you're not speaking, thanks so much. My name is Meredith Lee. I use she, her pronouns. I am the branch chief for our new Advancing Community Equity branch, where the CERI program is now living. And it is my great pleasure to actually introduce our new chief of the CERI section, Amy Zhang, who if you don't already know, you will have the opportunity to get to know very well over the course of this grant. And she's really just jumped both feet into this program. And so really, really thankful to her and to the entire team for helping us get this off the ground. And I will pass it, Amy, back to you for other introductions, including yourself.
Great. Hi, everyone. My name is Amy Zhang. I am the CERI grant section chief. I've been with the Office of Health Equity for a year now, and I've been with California Department of Health for 4 years. So it's really nice to meet everyone. And then I would also pass it over to Julie for her to introduce herself.
Hi, good afternoon, everyone. This is Julie Nagasako. I'm the Deputy Director of the Fusion Center. We're going to be continuing to work with the Office of Health Equity in partnership throughout the CERI grant, particularly in our capacity around state health assessment and improvement planning. But happy to be with you all today. Happy New Year.
Awesome. And then we would also like to introduce the technical assistance team. So Stephanie Pisano, she's our newly hired manager over the technical assistance team. So Stephanie, I'll hand it over to you.
Thank you so much, Amy. My pronouns are she, her, ella. And I'd like to say welcome to everyone. I'm so happy to be here with all of you and to continue doing some great work. I think I had the opportunity, I see some familiar names from the Czech LHD roundtable that we had this morning. But for those of you who weren't there, I do wanna, my background comes a little bit in the research center. I spent the last 10 years working for health awareness for Latinos in the US through research, through training, and through the development of culturally sensitive material, educational material. One of my favorite things was to work with community-based organizations and do trainings to our community health workers that we called promotoras. So I'm very, very excited to work with all of you. And now I'd like to introduce our STAR technical assistance specialist, who you'll be working more closely with. So if Haley, Janice, Jessica, and Selena can pop up their camera, introduce themselves, their region, and a little bit about themselves, that would be great. And we could start off with Haley. Or I saw that Janice was online. If Janice, you can kick us off.
Yeah, thank you, Stephanie. Hi, everyone. My name is Janice. I use she, her pronouns. I am the Equity Technical Assistance Specialist for the San Joaquin Valley region. And so I'm looking forward to meeting you all and working more closely together. Thanks. And I'll pass it to Selena.
Hello, everyone. Welcome. My name is Selena. I'm the Equity TA Specialist for the Bay Area region, and I look forward to working with you all. I will go ahead and pass it over to Jessica.
Hi, everyone. I'm Jessica. I'm located in Southern California region, specifically Whittier, California. I am an equity program specialist for Southern California region, and most of my work has been supporting vulnerable populations, especially those experiencing homelessness. I spent about 1.5 years in COVID response. I was able to see who was most impacted by COVID and developed a passion for health equity. So I'm so happy to be here and joining you all. And I will pass it over to Haley.
Hey everyone, my name is Haley Nee. I am, like the other lovely ladies who just introduced themselves, a COVID-19 Equity Technical Assistance Specialist. I work with the Rancho region, and so I'm seeing a couple of names that I recognize here today. And some of you have probably received some emails from me in the past, so I'm kind of like all around a little bit. My area of expertise is vaccine hesitancy and how to talk to individuals who are vaccine hesitant about their concerns. I worked a lot with vaccine hesitancy around the COVID-19 vaccine, but I've also worked with individuals and done research on vaccine hesitancy with other vaccines. So looking forward to talking with you guys more about this grant and, you know, any technical assistance that you need.
Thank you, Haley, and thank you, team. I'd also like to mention that we are hiring one more technical assistant specialist that will be covering the greater Sacramento area. So we're looking forward to having that person soon. And I'd also like to introduce Kristen Burnett, who is my direct supervisor and has been a fearless leader for our team. Kristen.
Hi, everyone. Good afternoon. I'm Kristen Burnett. I am the section chief for the COVID Equity Response and Recovery section, which the TA team is a part of. So nice to see all of you again.
With that, Amy, we'll pass it over to you. Thank you so much, everyone, and we're looking forward to working with you.
Lovely. Thank you so much, everyone, for the introductions. And LHJs, please feel free to introduce yourselves in the chat. You can put in your name and also your LHJ. And I apologize in advance if I have bad bandwidth issues, so I might be turning my camera off. All right, so we'll be going over the webinar for year 1 Q1 and year 1 Q2 reporting. If you do have any questions at any time during the webinar, please put them into the chat and we will be answering questions as they pop up in the chat. If we happen to miss it, feel free to retype in the question or you can wait till the end of the presentation where we will be going over a Q&A session. So we will just be going over a quick background about this funding source, the CERI grant, we call it the California Equitable Recovery Initiative, and that's the title we have established for this CDC grant. And the name of the CDC grant is in the blue box. It's RFA OT 212103. And the purpose of this funding is to address COVID-19 and advance health equity through strategies, interventions, and services that consider systemic barriers that have put certain groups at higher risk, including disproportionately impacted racial and also ethnic groups and rural populations. And so the focus for this local assistance funding is to really strengthen infrastructure and capacities in ways that both address disparities in the current COVID-19 pandemic and also set the foundation for an equitable recovery. So this funding provides an opportunity to address current disparities as well as long-term inequities. We're trying to begin with building infrastructure and organizational capacity through establishing core staffing, embedding equity into internal policies and practices such as workforce equity, budgeting and contracting equity, data policy, communications, and engagement practices. We are also trying to leverage strategies and practices aligned with the COVID-19 health equity playbook for communities. We also want to support prevention and mitigation of disparities in COVID-19 and other health outcomes, and also address structural and social determinants of health, which includes housing and homelessness, wraparound services, economic security, school, childcare, transportation, climate change, isolation support, and community safety, along with others. The base award funding that has been distributed to LHJs for local equity infrastructure is $300,000, and additional funds above base funding have been awarded using a formula-based allocation model. So this calculation includes 40% being population size, 30% of it being populations living in poverty, and 30% of it being communities of color with a minimum threshold of $100,000 to conduct targeted activities to address these COVID-19 health disparities. And regarding funded activities, there are 5 of them. So the first one is to establish equity infrastructure. The second funded activity is to implement targeted local equity activities. The third is to conduct an equity-focused organizational capacity assessment. The fourth activity being to participate in engagement activities with other LHJs. The fifth activity is to contribute to the statewide health equity plan. And now we'll be going over the reporting schedule. And if you're not on mute, could you please mute yourself? I try to mute as it pops up, but yeah, just a reminder. And here is the reporting schedule for what is due at each reporting period. So for this reporting period, Year 1 Q1 and Year 1 Q2 reporting will be due January 14th, 2022. And you can find this reporting schedule in your allocation letter that was sent out to all LHJs. And so Year 1 Q1 is just going to be the month of September, and Year 1 Q2 is going to be from October 1st to December 21st. So here are the dates identified with what is due. And there may not be much to report for Year 1 Q1 just because advance payments didn't come until later September. And because Year 1 Q1 is so short, we roll that up to be due along with Year 1 Q2. That's both due on January 14th. And this is the reporting that is due for Year 2. You can see that the final report due June 15th includes the final status for all expenditures and work plan activities. And again, you can find the schedule listed in the allocation letter that was sent to all LHJs. So reporting requirements. As a subrecipient of addressing COVID-19 health disparities among populations at high risk and underserved funding, the following reporting documents are be required to be submitted to CDPH. And for your convenience, we'll be issuing reminders as these dates get closer. So 1, you'll be submitting quarterly expenditure reports as updates to the spend plan following the dates listed in the grant allocation letter. And the spend plan and expenditure summary, that is attachment 1. And for 2, you'll be submitting semi-annual progress reports on status of timelines, goals, and objectives in the approved work plan. And such report should include notes of the tribal governments, community-based organizations, and or faith-based organizations that the county has included in its efforts. And so this is going to be attachment 2. And the third reporting requirement is a final report in this format, which will be required to be submitted at the end of the grant term. And there's also going to be other reporting items. And with regards to that, more information will be provided about these different types of reporting when it is available. And so you will submit data relevant to CDC outcome reporting requirements, and the CDC has requested data reflecting progress on the identified priority populations for this funding opportunity. And as part of the semi-annual progress report, LHJs will be asked to provide updates on selected CDC performance measures and available data where applicable, documenting such improvements for these populations based on the focus of local interventions.
Babe, can you close your door, please?
And this slide shows exactly what is due on January 14th. And we will later be going through each attachment, so attachment 1 and attachment 2 in more detail in future slides. And we emailed the most recent work plan and spend plans to each LHJ. And if you did not receive these documents, please let us know. We sent them out on Monday. So you can see that in attachment 1, which is the spend plan and expenditure report, you'll be providing any updates to the spend plan tab if you have updates. So this was previously submitted back in October. And the new portion that needs to be completed is going to be the expenditure report summary tab for year 1, quarter 1, and year 1, quarter 2. And for the work plan and progress report, which is attachment 2, you'll be providing any updates to the work plan that was previously submitted back in October, and you'll be completing the progress reports for 3 of the tabs. So the only tab that you do not need to complete is the state equity plan tab, just because we haven't sent out the assessment tools yet, but you'll be needing to complete the progress reporting for the 3 other tabs. And the third item that will be submitted by LHJs for reporting is also going to be the quarterly invoice. So you'll be submitting invoices if there's any expenditures that run from September 2021 to December 2021 that have exceeded the advance payment. So there might not be a lot of spending that has happened during this time, and if you have received an advance payment, you'll just, you won't need to invoice us until you've spent all of it. And here's the spend plan tab of attachment 1, the spend plan and expenditure report. This tab was completed back in October. And the spend plan is basically the overall budget of your entire grant period. And the instructions tab of this attachment includes details on how to complete entries that are each applicable for each spending category. So the spending categories are staffing, supplies, travel, equipment, subcontracts, and indirect costs. So you can see at the bottom that there's 2 different tabs on here, and this one is the spend plan tab, which was completed back in October. And you can submit spend plan revisions at any time to the equity email inbox, but revisions with more than a 5% difference must be pre-approved by CDPH. And if you have any significant changes to your spend plan, please list those out in your email when you send back your reporting materials to the TA team. And if you're just adding to a description, you don't need to provide us with that update. But if you do make changes to category amounts or move items to different categories, please make note of those changes in your email. Just gonna look at the chat box real quick to see if I missed any questions. And Rebecca from YOLO asked, so we can update our work plan blue if we were to have any changes to our plan, and the progress section green is providing an update on what we've done for that reporting. So yes, that is correct. We'll be going through that in more detail, but the blue is what has already been completed back in October. So if you have updates to that, you can make any updates, and the green is the new part that will be needed to be filled out. And Beth from Shasta County asked, what does it mean if there is a date range in red under the positions on attachment 1 spend plan? So let me go back. So Beth, I'm not sure what you're referring to. If anyone from CDPH wants to chime in, you can. So Beth is asking about a date range in red under positions.
So I think that's just based on ours that's filled out with the position titles already. I'm looking at the one that we have already filled out.
Mm-hmm.
And so under the positions that we have there, it's parenthetical the dates, and it could just be the dates that we want to have those people working under this grant.
Yeah, it definitely could be that because some positions might not take up the whole grant period, and it might just be a portion of the project period. But yeah, Julie will take.
Sorry, Amy, your audio's cutting out a little bit.
Okay, sorry about that. Let me turn off my camera real quick. Okay, turned off my camera. Let me know if I'm still cutting out. Sorry about that. Yeah, so not all positions are going to be budgeted for the whole project period. So it might just be a portion. Okay, so this is the second tab of the spend plan and expenditure report summary spreadsheet. And this is the tab that will be a new portion for LHJs to report. And so the expenditure report summary will be used for this reporting period. And this is a new tab to fill out. You will fill out the 2 columns that are in the red square. The first column is year 1, quarter 1, which is just the month of September. And the second column is going to be year 1, Q2, which runs from October to December. And the purpose of the expenditure report summary is for it to show a quarterly breakdown of funds for each LHJ. And it'll also show us how much of your advance payment you have spent if you opted in to receive an advance payment. And even if you didn't expend your total advance payment yet, you are still required to fill out this tab. So that way CDPH, we can track how much of your advance payment have been spent. And if you did not spend any funds in quarter 1 or quarter 2, so from September to December 2021, please indicate that by putting in $0 instead of leaving it blank. If we see that something is blank, we'll follow up with you. But if we see a 0 value in the cells, then we will know that you have spent $0. And now I'll pass it over to Julie, who's our Deputy Director for the Fusion Center, to go over details in the work plan.
Thanks, Amy. So as a reminder, the structure of the work plan is color-coded, and it is organized in these 4 tabs, as we discussed earlier. So tab 1 is around equity infrastructure, tab 2 for your targeted equity activities, tab 3 for the state equity plan process, and tab 4 for performance measures. And in general, throughout the work plan document, blue is the plan itself, gray is the instructions, and green is for progress reporting. And our focus for January is around progress reporting. So go to the next slide. A quick refresher that the tab 1 is the focus on equity infrastructure. One of the main focus for the use of funds in this section of the work plan is to hire dedicated equity lead staff. Our goal being 1 FTE per local health jurisdiction. There are some jurisdictions that are choosing to split that into a 0.5 FTE across 2 different positions, but in general, trying to establish this dedicated equity staffing capacity. In addition to staffing, there may be other activities that are helping to supplement your local equity infrastructure. And so go to the next slide. So for tab 1, again, instructions and examples are on the top. On the left, it will be filled out the detail that you've already submitted for your jurisdiction's work plan in the blue section. And what you'll be reporting for January is just completing this green section, particularly the column that says due January 14th. So for each activity, so for activity 1, you choose a progress status from the drop down, and then there are going to be 4 drop down options. 1, which is going to be not started, 2, which is going to be in progress, 3, which is going to be completed, and 4, which is encountering barriers, if you want to flag that you're running into some difficulty around that planned activity. So those options are available as a drop down. And then in the box below, you can use short sentences or bullets to describe the progress that you have so far on that activity or any barriers you're running into. You can also elaborate, as Amy mentioned earlier, on key partners that you're working with. So this is a space for a short update. You can see it's a fairly small square. Our goal is for this to be very feasible and streamlined reporting for all of you. And we're also very eager to hear about what you're working on and any difficulties you might be running into. So it's this short section. And then you do that for each activity. So if you had 2 activities on tab 1, for example, you might be hiring and then you might be doing a training, you complete that section for each of the activities on tab 1. And then we'll go to tab 2. Oh, sorry, I mean to the next slide, which describes tab 2. These are the targeted equity activities based on local priorities. And of course, these are scaling based both on your funding amount, your local capacity, and and hopefully they're leveraging the infrastructure that we're creating in the activities you described in tab 1. So if you're hiring an equity lead staff, these might be some of the community focused activities that you have that staff engaged in. Or you may have a dedicated project that you're facilitating in tab 2 as well. Many times these targeted activities might involve establishing local equity plans, work with community partners, activities addressing the social determinants of health. You've identified those already, and so this will be your updates on those activities so far. We can go to the next slide. So again, the same format for the tab. We'll be focusing on the green section. You can do the drop-down status for progress or any barriers, and then describe that in the box below. As mentioned, for both of these tabs, if you need to provide more, if you are making additions to your work plan, like perhaps you say, we know we're going to do an action plan, but we don't know what topic yet, because we're going to be learning that through our engagement with partners. But now you've identified that topic and you want to reflect that in your work plan, you can make those additions in the section in blue. What we ask is that if it's a major addition, like actually you're adding a whole new activity, or you want to make an adjustment to an activity, you know, to change the focus, instead of a training, we're going to establish an advisory board. Those types of changes, when you do submit your plan back to us with your progress report updates, if you could flag those in email, just so we know it's kind of a major activity change, versus if you're elaborating and just providing additional detail, then we'll see that here in your blue section of the work plan. And then we can go to the next slide. Okay, so this is tab 3, which is around the state equity plan. We're going to be doing a lot more work on this together throughout 2022. But we know that right now, the first step of that is going to be the organizational assessment. And we're planning to send the tool for that out to you at the beginning of February. Probably you'll receive the instructions in late January. So for the January reporting, you do not need to make any entries on tab 3. And so we can go to the next slide. That section is yellow. All the plan sections are yellow. So at this time, you can skip tab 3. And we'll go to the next slide. So this slide is for the CDC performance measures. The performance measure that the CDC is tracking for this grant is the improvements to equity infrastructure. So they're actually wanting us to count the improvements that are established through the funding in this grant. And our model that we're using is that each LHJ is asked to select at least 4 performance measures. There are 2 that are required that we're all doing, that each LHJ is hiring equity staff, each LHJ is performing the organizational assessment, and then you're able to select at least 2 additional items. Many of you chose more than 2 additional items because you're doing all kinds of amazing things. And we can go to the next slide. So this is what the performance measures tab looks like. On the left, in the blue section, is what you filled out during your work plan process. So you have X's that are identifying which measures you're going to be working on. And then there's a column for the target for how many of that thing you're hoping to accomplish during the funding period. For a couple jurisdictions, we're following up to make sure we do specify that target. For example, if hiring staff, how many staff? If conducting trainings, how many trainings? A number, a numeric target. And so then in the green progress reporting on the right, for any of the items that you've selected as the measures your jurisdiction is going to be working on, if you can note a progress status for that item, whether it's completed or in progress, not started, etc. And then you can, in the number of improvements column, list how many of those things are completed. So perhaps you intended to hire 1 staff, you've hired 1 staff, that whole performance measure, you've achieved and completed your intended goal. And you can include a short description to say, you know, we hired our equity officer, which is fantastic. For a lot of them, especially at this point in the process,
Yeah.
I know a lot of these will be either not started or very early in development. For many of them, throughout the course of the grant, you'll probably have partial completion. So maybe we plan to hire 2 staff. We've hired 1 of them. So we would know in progress, 1 improvement has been completed. And then in the description, we would say, in October, we hired our equity lead, but we're still recruiting for our community engagement specialist. Or we plan to conduct 5 trainings. We've conducted 2 so far. And then also in the description, that's always a place where you could also note if you're running into some barriers as well. And so this is going to allow us throughout the course of the grant to tally up how many improvements to equity infrastructure have been established. And we will use that in our reporting to the CDC because that's the numeric measure that they're capturing at this time. And I think that's it for me. And I'm going to hand it back to Amy. I'll try to look and see the question in the chat here first, perhaps. So for the number of improvements for staff, we put the FTE for number of improvements. So we hired 2 staff with their, interesting question. I think it would depend on how you described your target. I think we would probably describe those as 2 because that's 2 hires, that's 2 assets that are being established for your jurisdiction. So my thought is that it would be 2. If you want to dig in a little further and you prefer it to be 1, you can consult with your technical assistance specialist. But that sounds good to me. All right, we have consensus. All right, I'll hand it back to you, Amy.
Great, thank you, Julie. And so just to summarize the work plan and spend plan revisions, the initial work plans were submitted back in October. And so we recognize that the initial work plans, these were probably more general, and you can definitely make revisions based off of insights garnered from other organizational assessment activities and through the contributions of newly hired staff. Oh, sorry about my audio. Is it still bad?
We can hear you now.
Okay, cool. So yeah, if you have any major revisions, please just send that over to us in an email when you send over your reporting. So that way we can note changes on our end about what those are. Okay, now let's talk about advance payments and invoicing. So for the first quarter payment, CDPH, we issued out warrants to your agency for 25% of your total allocation. And this was issued as an advance payment, so there's no disruptions to cash flow. And not every LHJ opted into the advance payment option. And so if you do have an advance payment, you don't need to submit any quarterly invoices until your advance have been totally exceeded. But if you have your advance payment, you still need to complete the Q1 and Q2 expenditure report that's in attachment 1. And just because this will tell CDPH how much of the advance your LHJ have already spent. And about reimbursements and invoicing, so CDPH will be reimbursing your LHJ upon receipt of invoice. And you'll be submitting your invoices to the equity team inbox, and attachment 3 is the CDPH invoice template to use. And regarding supporting documentation to be is required. So you don't need to submit any supporting docs when you submit your quarterly invoice, but we do want you to have those documentation on hand in case we have any requests for it, and also just for auditing purposes. So it's recommended that documentation should be maintained for 5 years. And in your invoice, in the invoice attachment 3 template, please also just provide a itemized breakdown of your expenditures. And you can refer to attachment 5 for any funding restrictions. And again, this was sent out when we sent out all the documents, which were your spend plans, work plans, the allocation letters. And if you want another copy of that, feel free to email the inbox and we can provide that for you. Okay, so summary of the submission requirements. So please update the spend plan and work plan if you have any updates from what you initially submitted back in October. Please complete the progress report and expenditure report. So these are the new portions to be completed. And please submit any quarterly invoices if you have any expenditures that have exceeded your advance payment. And you can send all these completed materials to the Equity Team inbox at equityteam@cdph.ca.gov. And it'll take us around 1 to 2 weeks to review all the documentation, and there may be some back and forth for us between the TA team and also the LHAs just to clarify certain items on what you submit. And technical assistance consultation is available for any LHJ who have questions or would like to discuss further strategies for the work plan and spend plan development and also progress reporting. And so now we have a time to answer any questions that attendees have. So feel free to unmute yourself or type in your questions into the chat box.
Amy, while folks are thinking of questions, I can also just add one comment. This is from the CERI Q&A webpage, which is also a good place to look if you have additional questions that might pop up. But we know that every public health department's financial reporting process takes time. And so we had received questions about, the quarter is ending with December. Sometimes financials don't catch up until later in January or much beyond that. So what we're asking for is for you to provide the most current data available about expenditures. And if there are some that hit later and get captured as you close out each month and quarter, you can update those totals to be more complete in the following quarter's expenditure report. So I hope that makes sense. But I think the general process is we're just trying to capture everything that you're aware of at this time. And then you can make those revisions each quarter as we submit.
Great, thank you, Julie. And it looks like we have a few questions in the chat. So Barb asked, oops, sorry, hold on. If there are minor changes to the work plan, should we highlight them in some way so you can find these easily? If there are minor changes, you don't need to let us know, but if you want to highlight, you can. We just want to know of any major changes that occur, and then you can let us know those changes in your email when you send the reporting documents back to us. But if you're adding to a description, those kind of changes, we don't need to know about those changes. And another question is, who should I contact regarding questions on my budget? So you can contact the Equity TA team. So that's the same email that you'll be submitting your reporting to, and we can work with you on your budget and on any questions that you have. Jonathan asked from Shasta, in the expenditure report summary, the spreadsheet is not allowing zeros in the fields. It produces a $ with no numerical info. So we can check the expenditure report summary and see why it doesn't allow any zeros. It could be a formatting error, or yeah, we'll explore that more and we'll get back to you. If it's not allowing for zeros, maybe you can let us know in the email that you send back to us that you have expended no funds for those quarters. And another question is, why is the deadline so short for the financials? Out of the grants at CDPH, this is the only one with less than a 30-day turnaround. Most have 45 days. We apologize about just the, how short the reporting deadline for the first set of reporting. It's just so because we also need to provide information to the CDC as well.
Yeah, I'll just elaborate on that to say what we've done is we've worked 2 weeks backward from CDC deadlines from CDPH to the CDC, and that's the interval that's setting the LHJ deadline. But the flexibility that we have is that, you know, you can update with the next quarter's report. So you can report on what you have available, and then so that you might end up reporting on what you have current as of 45 days. But yeah, unfortunately, it's due to the CDC reporting schedule, but we're happy to be flexible in terms of allowing for updates.
Great, thank you, Julie. And regarding the question about just not being able to put zeros in the expenditure report summary, so Kathy from El Dorado stated that you have to change the formatting, so the dollar formatting in Excel to currency, and then it'll be able to show a 0 instead of being in accounting. And then Laura asked, can we talk more about the first quarter payment and the 25% rule? Yes, so with the first quarter payment, if your county requested an advance payment, you don't need to submit any invoices if you have until you've exceeded your advance payment. And your advance payment is going to be 25% of what was allocated to your county. And you don't need to submit any supporting documentation with your invoice. We just want you to keep that documentation on hand in case there's an audit or in case we want to see specific documentation. The contract managers, they'll reach out to you to request that documentation. The CDC and us, we recommend that you have this documentation on hand for 5 years.
And Amy, just one other thing to add is while we're not asking for folks who receive the 25% advance to submit invoices, we would like to know how you're doing in terms of your spending by putting it on the expenditure document. So that was one of the first slides that we showed with the table. So again, you don't actually have to submit the invoice, but it would be helpful for us. Thank you so much. Helpful for us to know where you are in terms of your spending down of that 25% advance payment.
Thank you, Meredith. And so this is the slide where you'll be just letting us know how much you spent, if you have an advance payment or if you don't have an advance payment. And then we'll be also updating our contact list continuously, since we know there's been a turnover at the county level with who's new that's on board. So please send over any updates on contacts for this grant. And apologies if we keep incorrect contacts on our contact list, where I'll be updating everything. So hopefully it'll be more exact. Okay, and feel free to ask more questions. I just wanted to go over the next steps. So the next steps, these documents are to be submitted by January 14th. And the Q&A page, that link that was shared by Kristen in the chat box, that is where we will be providing the slide deck once it gets ADA approved, and also the link to the webinar. And feel free to ask whatever questions you have, or if you want to request some technical assistant consultation at the equity email inbox. I'll just give it a little bit longer for folks to ask any questions that they might have. Okay, I don't see any more questions that are coming in. Does anyone from CDPH want to add anything before we close the call? Or does anyone from an LHJ want to share anything or have any other questions? All right. Well, I'll give you all 15 minutes back to your day. Thank you for your patience. Sorry about the connectivity issues, and feel free to chime in if you have any questions. We look forward to working very closely with all of you, and we're so excited that we have almost a full technical assistance team to be assisting with LHJs on reporting. Thanks all so much. I'll stay on a little longer just to copy and paste the chat, but if someone wanted to talk individually, we could do that as well. And I will try to get the recording posted ASAP. So I'm going to post it into the CDPH YouTube link, and then if we can, and then I'll send it out on the listserv, and I'll also have it posted onto the Q&A website. So just postings onto websites, those take a little bit longer because of ADA. So yeah, I'll be emailing it out. Thank you.
Hi, Amy. This is Laura Salcido from Tulare County.
Hi, Laurel.
Hi, I have a quick question where it's more so for clarification purposes. So prior to joining this meeting, I was part of the CHIEC meeting earlier this morning, and it was discussed that towards the end of next week, apparently there will be an organizational equity assessment that will be provided for feedback from the LHJs. So my question is, the process of that, or the purpose of that is basically for us to, one, provide the feedback, second, get that finalized on your end, and then use that as a tool towards the assessment that will complement the statewide equity plan, correct?
Correct, yeah.
Perfect, okay. That is my question.
Okay, cool.
Thank you.
And yeah, we'll be following up through CHIEC. They're going to help us coordinate with getting the draft of the org assessment out to a number of you who have generously volunteered, and so we'll be in communication through them.
Perfect. And also my immediate supervisor actually sent me the invitation for the CHIEC meeting this morning, but I'm not in their list. I did ask to be added, but I am part of this list for the CERI. So I just don't want to miss out on that opportunity. So now I'm Laura Salcido from Tulare County.
Tulare, okay, perfect.
Thank you.
Make note of that. Thank you.